Hi, I'm Vivian Shee, and I'm a pediatric nephrologist at Children's Hospital Colorado.
And I'm Kyle Rove, a pediatric urologist at Children's Hospital Colorado. Today we're going to be introducing a multidisciplinary stone clinic that we are starting together, where we will be taking care of children who develop and are at risk for kidney stones. As a urologist, it's not uncommon for other providers to reach out to us about patients who've developed kidney stones. Sometimes these patients come through the emergency department, their primary care doctor, or referred from other providers to our clinic. And we, as urologists, think about these kidney stones in terms of, is the stone causing pain? Is it obstructing the urine from flowing down to the bladder? And from a plumbing so to speak, standpoint, we counsel patients on various options for treating these stones, which might include observation, medical therapies, or even surgery in some cases. And we work closely with our nephrology colleagues, though, to work up these patients and treat these patients for their disease, because once you've developed a kidney stone, it's very likely that you are at increased risk as a child for developing another kidney stone in the future. And we really need our nephrology colleagues to help us evaluate and treat these patients to minimize the risk going forward. And Vivian's going to tell you more about that.
So as Kyle said, some pediatric patients may have just a one-off kidney stone, but we also know that many patients, about 30 to 40% of patients, will have recurrent kidney stones. And it is my job in pediatric nephrology to do everything we can to try to prevent the recurrence of these kidney stones. Some patients may have biochemical or metabolic abnormalities that their bodies have that we try to address with either dietary changes or medications to try to decrease the risk of them having recurrent kidney stones. In the Multidisciplinary Stone Clinic, I, of course, will be working very closely with our urology colleagues on the surgical management of this, but then also working very closely with my dietitian colleagues to provide recommendations that are both practical and doable in terms of dietary changes and lifestyle changes to hopefully decrease the chance that they will have a recurrent kidney stone.
In caring for patients with kidney stone disease, both my pediatric nephrology colleagues and my team in pediatric urology have realized that it would be better for patients and their families if we cared for them in a single location. And that's why we're starting this multidisciplinary clinic. In this way, families and patients can come to us on a single day and get their imaging, their labs, and see all of the various providers that we want them to see in order to minimize their risk of future kidney stones and treat any active disease. This will really help streamline the care for these patients, and we think it'll be providing a much better service for them.
Thank you so much for joining us today. If you have any additional questions, please refer to the information on the screen.